Hi everyone, welcome back to My Hero Academia Podfics. Today I'm going to be picking up with Chapter 3, which is Part 3 of the Deku D.O fanfic that we've been reading so far. Chapter 3 is entitled No Exit. Just some forewarning, this is a lengthier chapter, and this one in particular has a lot of medical jargon and a lot of procedures and things going on, so just bear with me if I stumble through a couple words. I'm going to do my best, but no promises. With that being said, let's go ahead and get started. All right, night shift, listen up. Takahashi Shiori, the second shift attending, called. We've got word of a mass casualty event from one of our friends in emergency medical services. We have 10 incoming trauma cases arriving in about 20 minutes. 10, Izuku gasped. They only had about 4 doctors and 6 nurses on shift. Quirkless support group rented a bus for a day trip and were T-boned by a nearby villain who had gotten into a car chase with the police. The driver had a quirk and was sent to Musutafu Memorial, but we were lucky that one of the EMTs was actually an ally of ours and knew to send the quirkless patients to us. They were able to gather a couple of volunteers to help drive the patients here. 20 minutes is a long time to wait before treating that kind of trauma. Would it have been better to let them take their chances with the hospital? Michi wondered. No way, Natsu crossed his arms. You're quirked and still relatively new here, so you wouldn't be expected to know, but Musutafu Memorial has a blanket policy of refusing all quirkless patients, emergency or not. All that would have done is waste more precious time, and we don't have time to waste. Do we have any more info on what we're looking at? As of 10 minutes ago, we had 2 red tags, 5 yellow tags, and 3 green tags. Of course, that could change during transportation, so be prepared for as many as 7 red tags. As of this moment, we're putting the clinic on bypass, Takahashi ordered. Matsumura, put all of our current patients on a hold and do your best to keep them happy. Direct all non-emergent cases to our sister clinic in Hosu. Incoming emergencies should be logged and tagged based on the field triage system. Aye, aye, Captain, Matsumura saluted. You've got it. As for our nurses, Harada, you're on patient intake. Umeda, Azuma, and Aoki, exam bays 1, 2, and 3, respectively. Be prepared to move more quickly when our patients arrive. We will try to be direct, no more than 1 red tag patient to each of your stations to avoid overwhelming you, but there's no guarantees. Yes, Sensei, Umeda Subara, Aoki Michi, and Harada Eito, and Azuma Mari all chorused at once. Yoshida-san, Takahashi began. Chances are we're going to have surgical patients. Scrub into the OR now. If for some reason we don't need an operating team, you'll be afloat. On it, Yoshida responded determinedly. What about me? Kuwahara Hanako asked timidly. She was the youngest nurse at just 13, and she specialized in pediatrics. You're on medication dispensary and lab orders. Use a triage system. We have sparse resources. Make sure that all restricted medication orders go through to those who need them, and the ones that have supplies go missing or get wasted, we want to make sure that everything's being inventoried properly and that we're getting the patients the medication that need it. That goes for all of you. If Kuwahara-san says she can't fill your prescriptions, then you damn well better listen and figure out something else. We're expecting a new shipment of meds tomorrow afternoon. Until then, we'll make do with what we have. Right. Now on to our doctors. I will be taking exam bay 1. Todoroki, take bay 2. Sakuma, you're on bay 3. Midoriya, you're in the OR. As soon as you're done with any emergency operations, take over bay 3 so that Sakuma can switch to psychiatric rounds. If psychiatric intervention becomes necessary before you are finished, Todoroki and I will cover bay 3. Does everybody understand their assignments? Good. ETA is now 10 minutes. Break. Izuku didn't waste any time in rushing to the ER and scrubbing in. You ready for this? Yoshida asked as they pushed into the OR. Nobody is ever ready for this, Izuku said grimly. We don't know what is coming through those doors. However, statistically speaking, the most common emergency surgeries after traumatic car incidents include craniotomies and other brain surgeries to repair skull fractures and brain bleeds, spinal fusions and discectomies, and cauterization of internal bleeds. So nothing too difficult, right? Yoshida offered a wan smile. And just think, once we're all done here, we'll likely have some nice, easy fractured bones to reset. There is that. Plus, I refreshed my cranial anatomy knowledge in biology class this morning, Izuku joked before turning sullen. Let's just hope I don't have to use it. Their pagers simultaneously started beeping. They're here. Central ER 2143. What have you got for us? Harada demanded as one of the volunteers rushed in with the first patient, who he promptly placed on the awaiting gurney. According to his ID tag, his name is Yasui Chiasa, 32 years old, severe respiratory distress, suspected broken ribs, and a moderate laceration. He's conscious but not lucid. All right, take him to Bay 1. I've got him, Takahashi called, pressing an oxygen mask to the patient's face as she and the volunteer rolled the gurney. Yasui-san, can you hear me? The patient only groaned in response. I need 300 cc's of lactated ringers stat. The trio quickly vanished into their assigned med bay. Incoming, Bay 2, Harada called. Natsuo ran up to the doors with Azuma. An EMT, their probable hero of the day, rushed in with a young woman in his arms who he placed on the nearest gurney. Jane Doe, probably in her 20s, but I can't be sure. She's non-responsive, but her breathing and heart rate is stable. Compound tibia-fibula fracture in her right leg. The EMT promptly reported. She has a moderate abrasion on the back of her head, and I've already controlled the bleeding. Thanks, madam. Can you tell me your name? No response. Can you open your eyes for me? Once more, the patient didn't respond to Natsuo's question. After waiting a split second, Natsuo began to apply pressure to the patient's fingertip. Her eyes remained shut. Natsuo grabbed the patient's left trapezius muscle and squeezed gently. The patient jerked their shoulder away. GCS-7, we're taking her straight to CT, Natsuo ordered. Azuma, 100 cc of iodine contrast. After the patient was wheeled away, the EMT turned towards Harada. We should have one more red tag, 4 yellows and 3 greens coming in. The yellows are in 2 transports while the greens are sharing a third. Thank you, Harada noted down the numbers. Any chance you could stick around? We're extremely short-handed at the moment. Sorry, the EMT shook his head. I wish I could, but I'm on the clock right now. I've already been AWOL for just under an hour, and my captain won't be able to cover for much longer. I understand, Harada answered. I won't keep you any longer. Thank you for everything. You're a real hero. I couldn't just leave them there. Let me know if they're okay. Takahashi-sensei should have my number. Of course. Medbay 1, 2145. Takahashi checked the oximeter on the patient's finger. He's tachycardic, pulse of 145. Oxygenation is at 79% and isn't rising. She pressed her stethoscope to the patient's chest. No breath sounds on the left side, probably a pneumothorax. We'll need to do an ultrasound. Unbutton his shirt. All right, there you go, Sensei. Umeda handed over the ultrasound and gel. Sorry, this is going to be cold, Takahashi warned before squirting the gel onto the patient's chest. The man groaned slightly in protest. I really don't see any lungs sliding on the left side there. I was right, it's a left side pneumothorax. We're going to have to aspirate. I'm fairly certain we're out of pleural drainage kits, Umeda interrupted. What do you want me to do? Get me 4 cc of 2% lidocaine and 18 grams of cannula and a spinal tap kit stat. On it. Sir, the reason you've been having trouble breathing is that your left lung collapsed. Basically, the trauma from the crash caused air to leak into the space between your lung and chest wall. We're going to insert a needle into this space to release the air and allow your lung to expand, which should return your breathing to normal. I will use a local anesthetic to numb the area beforehand. You should only feel a little pinch. Do you understand? Yes, the patient wheezed. Do I have your consent to proceed? Yes. All right, let's begin. Takahashi pulled on a pair of nitrile gloves before sterilizing the area with an alcohol swab and placing drape over the procedure area. I'm going to insert the needle with lidocaine now. You'll feel a small sting. There, done. Now I'm going to do the same thing, but it's going to be a little deeper with it, okay? The patient grunted in response. As she injected a little bit of the lidocaine, Takahashi slowly moved the needle up and down to release some of the air from the pleural cavity. When she was finished, she filled the cannula with the remaining lidocaine and inserted it at a 90-degree angle into the intercostal space on the mid-clavicle line. Umeda made sure the cannula doesn't kink. Takahashi ordered, removing the needle from the tubing. All right, you can attach the 3-way tap to the top of the cannula and the 50-milliliter syringe to the tap. Roger that, Umeda responded before proceeding. Everything looks good. All right, have you done a pleural aspiration before? Only once, Umeda admitted. All right, I'm going to walk you through it. All you need to do is slowly and steadily draw air out of that with the syringe. Stop once you start to feel resistance. Okay, Umeda took a deep breath before starting to pull the syringe plunger. What do I do if the syringe is full, but I'm still not feeling resistance? Not to worry, I expect that will happen several more times. Let me turn the stop clock here, and you can detach the syringe and empty into the air. Make sure you don't lose any of the lidocaine. Right, okay, I've attached the syringe. Okay, rinse and repeat. Central ER, 2149. The EMT had barely left when the next patient was rushed in and dropped on the awaiting gurney. Adachi Ko, 47, he's lost a lot of blood. He was awake when we left the scene but lost consciousness en route. He doesn't have a pulse and isn't breathing. Code blue, Sakuma shouted before pulling herself onto the gurney to begin chest compressions. Michi rushed over, dragging a crash cart with him. Give him 1 cc epinephrine. We don't have time to establish an IV line, so it'll have to be an intracardiac injection. Michi pulled the requested needle and dosage from the cart before injecting into the patient's heart. Take over for me while I bag him, Sakuma ordered, before switching places with Michi. Harada, leave intake to Kuwahara and get the patient hooked up to a monitor. Yes, Sensei, Harada shouted. He's bagged, Sakuma reported. Harada, are you done? Almost. Give me a second there. You handle the bag. Looks like fine, V-fib. Michi, give him another dose of the epinephrine. I'm going to start on the AED. Takahashi pulled the yellow plastic AED case from the crash cart, and Michi re-injected the patient. Watch your hands, I'm cutting off his shirt, Takahashi warned before proceeding to slice through cotton. Damn it, we're going to need to shave him. I'll do my best to work around you, but you'll have to pause CPR for a moment. Just give me the heads up. An ominous crack accompanied the next compression, and I definitely just broke this guy's rib. Good, that means you're doing it right. Better a broken rib than dead, Takahashi replied quickly as she shaved off as much of the patient's chest as she could. Pause so I can get the last spot. Michi stopped his compressions. Here, I'll help you attach the pads. Together, the two of them hooked up the patient to the defibrillator. Clear, Takahashi ordered, pulling away from the patient. Harada dropped the airbag and took a large step back. The patient's body contracted with the electric shock. Still nothing on the monitor. Resume CPR and breaths. All right, Michi, give us the next dose of epi. Done. Clear. The body convulsed again. Shit, he's asystolic. Resume CPR. He's not going to recover, Harada noted sadly. Well, we have to try. Even with CPR, we have 15 minutes from asystole to brain death due to oxygen deprivation. Takahashi-sensei, swap with me. I'm not going to be able to keep doing this much longer. Right. 1, 2, 3, swap. Michi breathed a sigh of relief and rubbed his arms. 2 minutes later, Harada swapped in. Still nothing. Give his next dose of epi, Takahashi ordered. The team continued to swap out with each other, giving additional doses of epinephrine every 3 minutes. By the time 15 minutes had passed, Michi was doing compressions once more. Michi, it's been 15 minutes. I'm calling it. Michi froze, looking like he was about to argue, before nodding slowly and climbing off the body. Time of death, 22:13. Imaging room, 21:47. Ready to lift her into the machine? On the count of 3. 1, 2, 3, lift. Natsuo and Azuma heaved the patient into the CT scanner. All right. Natsuo ran his finger from the bottom of the patient's foot to the top. The toes reflexively fanned out. Positively, Babinski said, there's that. Let's see what the CT scan can tell us. Natsuo started up the machine and an image loaded onto the monitor. Shit. We need to get her to Izuku now. OR, 21:49. Epidural hematoma, it's small, but only 20 cubic centimeters and 15 centimeters thick, Yoshida announced, caused by a skull fracture tear in the middle meningeal artery, but she's a GCS7, so we need to operate. A craniotomy then, Izuku concluded. Do we know anything about the patient? Young Jane Doe, Yoshida shrugged. I'm guessing she weighs about 55 kilograms. I'd given her the loading dose of propofol and hooked her up to 330 milligrams infusion set to 60-minute infusion rate. Okay, secure her head to prevent movement while I shave her head, Izuku ordered, selecting a razor from the surgical cart. It's a shame, Yoshida commented idly as Izuku began to shave the patient's hair. Her hair was so long and pretty. Well, if we do this right, she'll hopefully have a chance to grow it back, Izuku responded. All right, I'm done. Hand me the marker. Here you go. Izuku took the marker from Yoshida and drew large arch over the location of the hematoma. This is going to be a long procedure. What kind of music are you in the mood for? Yoshida pondered. Classic K-pop? 21st century? What do you take me for, a heathen? Of course 21st century. Sounds good. Hand me the scalpel before going to turn it on. Izuku cut along the mark, pulling back the soft tissue to expose the patient's skull. Just as he finished the incision, Blackpink's Shutdown began playing on the overhead. I will never get over how cool the human body is, Yoshida explained upon returning. Well, at least you know you're in the right field. Hand me the drill. Very carefully, Izuku drilled 4 small holes in the patient's skull, creating the shape of a square. bone saw. Here you go, boss. Yoshida handed the saw over. Izuku began sawing between each of the holes. Be ready with a sterile container for the skull fragment once I remove it. Already have one prepared, Yoshida responded. Izuku hummed in acknowledgement and continued to saw. A while after he freed the section of bone, dropping it into the container Yoshida provided. Look at that. Wow, Yoshida whistled. Now that's nastier than it looked on the scans. It's no wonder she's a GCS-7. That clot must be putting a ton of pressure on her brain. Luckily, we can fix that. Suction. Izuku gingerly placed the suction tip against the large blood clot and began the painstaking process of removing the hematoma. It took well over an hour before the clot was fully removed. Damn it, she's starting to bleed again. Cautery pen? Trade you. Yoshida exchanged the pen for the suction tool. Izuku gently pressed the pen to the bleed, using an electric current to seal the wound. Okay, that should do it. Her bleeding should be fully stopped, so we should be good to replace the skull flap without a drain. We'll just need to keep a close eye on it for a few days. All right, I'll make sure the nurses know. Thanks. Hand me the anchors and the screws one at a time. Izuku put the bone fragment back in place and attached it to the rest of the skull with the metal anchors and screws. Page Natsuo to come get his patient. All that's left is to suture her up. Got it, Yoshida sighed. And then, let me guess, cleanup duty? For both of us, Izuku nodded grimly. I'm sure we'll barely have enough time to grab a protein bar and a cup of coffee before our next procedure. I bet we all could use some coffee by now. Maybe I should page Matsumura-kun about starting a pot. He's probably busy, but you can ask. Matsumura-kun, any chance for some coffee? Yoshida spoke into her pager. A minute later, her pager beeped with a reply. I got you, girl. Did you hear that, Zuku-sensei? I heard, and good timing, too. We're done here. Izuku stepped back from the patient. Just then, there was a knock on the OR door. We're done. You can come in, Izuku replied. Natsuo pushed the door open. Everything go well? Yep, Izuku replied with a cheery, exhausted cheer. Just keep an eye on her to make sure that she doesn't start bleeding again in the next couple of days. The hematoma was worse than it initially looked, so on the scan, so I can't say for sure what her prognosis will be. We'll take her off the anesthetic, and you should have a better idea on or if or when she wakes up. Thanks, man. Natsuo smiled grimly. Giving you a heads up. Turns out that Takahashi's red tag has a significant abdominal bleeding and will need a surgery stat. We've already put it off too long due to understaffing. Shit, Izuku cursed. Is anyone available to sanitize the OR? Yoshida and I need food and coffee if we're not going to screw this one up. Azuma-san can handle it, Natsuo responded. All of our patients are stable right now. Thanks, Yoshida breathed a sigh of relief. How many patients do you have? Our Jane Doe here, who is a red tag, a young woman with a closed arm fracture and a moderate concussion, and an older gentleman with some minor abrasions and a broken wrist. It's not as bad as I feared, Izuku offered. I had it easy. Sakama's red tag was a DOA. Well, shit. Anyways, go and change and grab your food. The ER will be ready for you in 15. Thanks again, Izuku smiled at Natsuo before pushing out of the OR. Waiting room, 11:50. The entire waiting room was awash in the din of discontent patients by the time Izuku arrived. We've been waiting here for 4 hours, a woman cried gently, bouncing a distressed infant in her arms. Kaoru-chan needs to see a doctor. I'm sorry for the inconvenience, Matsumura placated the woman. As I've said before, we're currently dealing with a mass casualty event. All of our doctors are currently tied up with patients in imminent danger of losing their lives. While Kaoru-chan's health is very important, he's not in any imminent danger right now. What about that one? The woman pointed wildly at Izuku. Hey, it's a doctor, one man shouted. I'm next in line, another chimed in. No, you weren't. We were here first. Well, I'm sicker. Shut the fuck up. You're fine. My sister is way worse off. Everyone, please calm down, Izuku shouted. The crowd hushed. I just got out of a 3-hour brain surgery and am stopping to grab a cup of coffee so that I'm alert for my next emergency procedure. We will sue you as soon as we are able, but you must understand, we are a volunteer operation. The doctors are pulling 12-hour shifts for no pay so that you can receive care. We are severely understaffed, and we are dealing with patients who are dying right now. We already lost one person tonight, so please be patient and kind to your doctors. We are struggling too. I know it is hard to wait when you and your family feel sick, but know that we are doing the absolute best that we can. If you want to help speed things up, I know that we could use some volunteers to help with basic tasks like cleaning, sorting through patients' personal belongings, changing sheets, and making food. Anybody who is healthy and willing to help can come talk to me, Matsumura announced. Thanks, Zuzubin. Your coffee was behind the desk. We really need a designated staff room, Izuku responded. With what space? Matsumura snorted. Maybe we could work something kind of deal with the internet cafe. It's not a bad idea. I'll bring it up with Takahashi-sensei. Izuku nodded and took a deep sip of his coffee before heading back into the makeshift ER. Hey, Izuku. You're going to be a great hero. Central ER, midnight. Hey, Harada-san, what's the situation? Izuku asked the weary-looking nurse. Currently, we have one red tag. Your abdominal bleed in room 1 came in with a pneumothorax, which Takahashi-sensei treated, then started displaying signs of blood loss with a distended abdomen. We've been transfusing him while we waited for you. There are 4 yellow tags of various severity. The worst off is patient in room 3 with some sort of spinal injury. We have a couple of compound fractures, but it looks like those will have to wait for the next shift at this point. We were able to get in contact with a handful of people who agreed to come in early. They should be here in a little over an hour. We sent our 3 green tags to the waiting room. Now that the Jane Doe is out of surgery, we'll ask someone to go identify her. That's great news. Speaking of the waiting room, I got Matsumura to assemble a bunch of volunteers to help out with basic housekeeping tasks. Hopefully we'll be able to get enough people to take the edge off. And that is why you're our resident genius, Harada sighed. That'll be a huge help. Now, if you're done with your coffee, go have your abdominal bleed patient sign his consent forms. Harada pressed a patient chart into Izuku's chest. Yeah, I'm going, Izuku sighed, pushing back the curtain to Bay 1. Izuku glanced down at the chart. Yasuichisa-san? Yes, the middle-aged man on the leftmost bed responded. I'm Midoriya-sensei, and I'm going to be your surgeon today. I want to go over the procedure and some paperwork with you, if that's okay. Yeah, sure, the man coughed lightly. Sorry, my breathing isn't completely normal. I see you had a needle aspiration earlier for a pneumothorax. It's not uncommon to feel some effects for a few hours after the procedure. Now, essentially what we're going to do is exploratory surgery into your abdomen to locate and cauterize any bleeds. Cauterize? You're going to burn me? Not exactly. We use a small electrical current to heat the tissue and seal off the wound. You'd be under general anesthesia, so you shouldn't feel any pain during the procedure. The big issue is we won't know exactly where you're bleeding until we start the procedure. Depending on the location and severity of the bleeds, we may elect to remove the whole or parts of some of your organs to keep you safe. My organs? I understand that this can be a bit scary to hear, and we will do everything we can to prevent that outcome, but it is a possibility. Which organs could I lose? We can't really say for sure. The liver tends to be the most commonly damaged organ from abdominal trauma, but it's not the only one that we can remove. If your liver has sustained severe damage, then we will need to talk about next steps after the surgery. Another area of concern due to its location is the spleen, and it isn't unheard of for surgeons to need to remove very small sections of intestine in cases like these as well. Please know that it is highly unlikely that we will need to remove any of your organs, but we do need to inform you of the possibility. I understand, but that's the man's side. Do I really need the surgery? Are the transfusions enough? Sir, without the operation, you will bleed out. You need it to survive. Yeah, I thought you'd say that. Look, I can't say things will go perfectly, but this surgery, while significant, is relatively low risk. You face a greater risk if you refuse treatment than you do with the procedure. All right, I'll get the operation. I'm glad to hear that. Now, I need to go through these consent forms with you, certifying that we talked about the risks of the operation and that you are electing to proceed with full understanding of these risks. Just show me where to sign. I want to get this over with. Izuku handed the patient his papers and pointed at the signature line. All right, a nurse is going to stop by to prep you for surgery and administer anesthesia. I'll check in with you on the other side. Thanks, Midoriya-sensei. Izuku walked out of the bay, pulling the curtains shut behind him as he did. It was time to scrub in again. OR 1:30. And done, Izuku sighed, wiping his brow. Looks like he only had one major bleed. He'll be happy when he wakes up with all his organs, Yoshida laughed. Anyways, I'll clean up here if you want to change and take the patient back to Bay 1. Thanks, you're an angel, Izuku smiled at his friend before rushing into the changing rooms to divest himself of his scrubs. Hey, Izuku, Natsuo poked his head in. Just change into your civvies. Shift 1 is here to relieve us. Oh, thank All Might, Izuku breathed a sigh of relief. This was a shift from hell. You're telling me. Do you want to lift a UA? I won't say no if you're offering. Great. I'll be waiting in the central ER. Thanks, Natsuo. Izuku wasted no time taking a quick shower and changing into his sweats. He grabbed his bag from his locker and made his way to meet Natsuo. Izuku-kun, I heard you had a rough night. Ito greeted cheerily as Izuku entered. Izuku just glared. Since you seem so eager to foist off your cleaning duties on Michi, why don't you clean the OR? We just did an exploratory surgery for electrocauterization, and there's plenty of blood to share. See if I ever offer you my mighty tower discount again, Ito huffed, acknowledging the irony. Well, I guess I'm off to the OR. Izuku turned toward the nurse station in the center of the room where Obi Kozu, the shift 1 head nurse, was shuffling through their paperwork. Hey, Obi-san, Izuku greeted. Do you have an update before I go? She gave a slight hop in surprise, her kangaroo mutation quirk making the jump go higher than it normally would. Hey, Midoriya-sensei, thanks for your effort tonight, she said cheerily. Thanks to you, we don't have any more red tag patients. Our Jane Doe is identified by one of her friends as Ogawa Minako, a special education teacher. She hasn't woken up yet, but she's showing increased brain activity, which is a good sign. I'm really glad to hear that, Izuku said, relieved. Could you please check in with my abdominal bleed patient when he wakes up and let him know that I'll come see him tonight? I promised I'd check in with him, but he hasn't woken up yet. No problem, and you don't need to worry about us. We've managed to treat all our non-surgical crash patients, and the only surgeries left are a couple of compound fractures, which Umura-sensei can knock out in a couple of hours. We've already started to work on our patient backlog, and we'll be able to take the hospital off of bypass in the next few hours. Thanks, Obi-san. Oi, Zuku, I'm leaving without you if you still want that ride. Coming, Izuku jogged over to Natsuo. Bye, Obi-san. They quickly reached the car, and Izuku slid into the front seat with practice ease. Only a few moments later, Natsuo was pulling out of his illegal parking spot in an alley and onto the main street. Ugh, Aizawa-sensei has been getting on my case about working so late. I'm going to need to sneak back into the dorms tonight, Natsuo frowned. Are you going to be all right? Should be. Aizawa usually keeps watch in the common room. I'm wearing dark clothes and I left my bedroom window open, so it should be easy enough to climb the tree outside and slip in. You had a long night. Don't do anything stupid. I won't, Izuku promised, but you know better than anyone that I can't cut back my hours at the clinic, and I can't tell Aizawa why it's so important that I work late at my totally legal part-time internet cafe job, so this is what I'm left with. You could always quit here at school and join me as a med student. No one expects med students to sleep anyways. We're all too busy studying. Nice try, but I'm going to be a hero. I know, Natsuo sighed. Is it bad that I sometimes wish you didn't develop your quirk? Like, I'm proud of you, just the way you are, but it would be nice to have a quirkless hero, and I think you could really have done it. You know, you're the only one who has ever said that to me. I wish I'd heard that years ago, Izuku teared up. And I may have a quirk now, but in many ways that matters. I'll always be quirkless. I always will be a part of the community by virtue of our shared experiences, and I will always be a hero for people like us. Sure, I won't bring the kid of the mainstream quirkless representation that a fully quirkless hero would, but I can still be a hero for our community. I want kids like you and me to see my red shoes and know that there is a hero that is safe. I know, Natsuo smiled, and you're going to be better than everyone who came before. And one day, when some kid asks if a quirkless person can be a hero, you will be there to say yes and support them. I hope so, Izuku smiled. Well, on that somewhat heavy note, we're here. Good night, Natsuo. Get some sleep. You too, don't get caught. I won't. Izuku unbuckled his seatbelt and made his way onto UA's campus. He didn't run into anyone as he headed back to the dorms, scaled the tree by his window, and slipped into his room. Before long, Izuku was snuggled in his bed, eyes heavy with sleep. Well, tonight wasn't so bad after all, he murmured into his pillow as he drifted off into his dreams. And that concludes Chapter 3, which is Part 3 here of Deku D.O. I really like this fic. I like that particular chapter touches base so much on like the medical procedures and a serious emergency, so we get a real glimpse into how hectic it can be in there for him. Really enjoyed this one a lot, though, and I'll say it a million times in pretty much every video that I post of this. And I hope you guys are enjoying it as well. Drop your feedback and your thoughts on the fic below, and also make sure you guys are throwing down there any other fics that you want, because otherwise I'm just picking ones that I like, which is fine too, but I want to hear from you guys which other fics that you think would be good for this as well. Thanks so much. I really appreciate it, guys.